Welcome to the Calibre site initiation visit. My name is Lisa Holden and I am the trial manager for the Calibre trial at BCTU. This training is mandatory for any site opening to recruitment. The Calibre trial is looking at carvedilol versus variceal band ligation in primary prevention of variceal bleeding in liver cirrhosis. We are using the updated protocol version 3.0 dated the 7th of September 2021. The team leader at Birmingham Clinical Trials Unit is Gemma Slynn, the chief investigator is Professor Diraj Tripathi, the sponsor is the University of Birmingham and the trial is funded by the NIHR. During the course of this SIV, I will provide some background information to the trial, the objectives of the trial, details of the study design, information on data handling and pharmacovigilance. Liver cirrhosis is the 5th largest cause of death in the UK, with the average age of death at just 59 years old. This causes a great economic impact due to the need for hospitalisation and time off work. A major complication of liver cirrhosis is variceal bleeding. Variceal bleeding has a 1-year mortality of up to 40%. The aim of treatment is to reduce the risk of the first variceal bleed. There is disparity in the current UK guidelines. NICE guidelines recommend variceal banding and BSG guidelines recommend non-selective beta blockers. There is little evidence currently comparing the two treatments, which is why a large randomised controlled trial has been funded. The primary objective of the Calibre trial is to compare carvedilol and variceal band ligation in preventing any variceal bleed within 1 year of randomisation. There are a number of secondary objectives looking at the effect of carvedilol and variceal band ligation on survival, the development of other complications of psoriasis and adverse events. The cost effectiveness of treatments will also be compared together with patient preference and the use of alternative or crossover therapies. The study is a randomised control parallel group trial. There is a 6-month pilot to assess recruitment post-COVID-19. It is open label and there are 2 intervention arms, carvedilol and variceal band ligation. The aim is to open 75 UK sites in total and to recruit 2,630 participants. Participants will remain in the trial for 12 months. The internal pilot has various stop-go criteria to enable the trial to continue, such as recruiting more than 400 participants, to open 75 sites, to obtain 90% data completeness and that there are no safety concerns. This would equate to 1 patient per month per open site, and the aim is to open 3 new sites per month over the 6-month pilot. This is a summary of the trial. If the participant meets the inclusion criteria, informed consent is obtained and a diagnostic endoscopy is performed. The participant will then be randomised to either variceal band ligation or to receive carvedilol. There is an additional safety visit at 2 weeks in the carvedilol arm to ascertain if there have been any adverse events. All participants will be followed up at 6 months and 12 months in line with standard of care. The inclusion criteria is any patient with liver cirrhosis as defined clinically, radiologically, with transient elastography or on histology, and they also must have medium or large varices as defined in the BSG guidelines that have never bled. The exclusion criteria is anyone under the age of 18, anyone with a known intolerance or contraindication to beta blockers including asthma, acute alcoholic hepatitis at the time of randomisation, the current or history of variceal band ligation, presence of malignancy or systemic disease that significantly affects 1 year survival, pregnant or lactating women, participants unable to give informed consent, a current or past history of non-selective beta blocker use, such as carvedilol, nadolol or propranolol, previous organ transplantation, and patients with surgical or radiological port systemic shunts, such as TIPS. Recruitment. A medically qualified doctor who has delegated the duty on the delegation log must confirm participant eligibility. Participants may be identified and recruited by planned endoscopy, outpatient clinic referral or inpatient referral. Only participants who have not yet started treatment will be eligible. Figure 1 on page 32 of the protocol shows the consent process during a planned endoscopy when no diagnosis of varices has yet been made. The patient with liver cirrhosis is advised of the need for an endoscopy to check for varices. The patient is sent an appointment letter together with the Calibre trial patient information sheet. The patient will then attend hospital for the endoscopy procedure. The patient will be approached by a member of the research team to discuss the Calibre trial. If the patient decides not to take part in the trial, they will receive standard of care per NICE and BSG guidelines. If the patient decides to take part in the Calibre trial, consent will be obtained and the patient will have the endoscopy. If the patient is found to have medium to large varices, the patient will be randomised to Calibre to receive either carvedilol at 12.5 mg once a day or variceal band ligation. If the patient is found to have small or no varices, they again will receive standard of care per NICE and BSG guidelines. Figure 2 shows the schema on page 33 of the protocol, showing the consent process following a referral from an outpatient clinic, following a confirmed diagnostic endoscopy. So the patient has confirmed medium to large varices and they're referred to the Calibre research team. The patient is provided with the Calibre patient information sheet and the patient is seen in clinic as soon as possible thereafter, preferably within 2 weeks. The patient is then approached by the research team in clinic and have the discussion about Calibre. If the patient declines to take part in Calibre, they will receive standard of care. If the patient decides to take part in Calibre, the patient gives informed consent and is randomised to the Calibre trial to receive either carvedilol at 12.5 mg once a day or variceal band ligation. Figure 3 shows the schema on page 34 of the protocol, showing the consent process following an inpatient referral. So the patient has been diagnosed with medium to large varices and is referred to the Calibre research team. The patient is provided with a Calibre patient information sheet. The patient is approached in clinic by the member of the research team. If the patient then declines to take part, they will receive standard of care. If the patient decides to take part, informed consent will be taken and the patient will be randomised to the Calibre trial to receive either carvedilol 12.5 mg once a day or to variceal band ligation. The participant must sign and date the latest version of the informed consent form, which is version 4 dated the 7th of September 2021, initialing all boxes if the visit is face-to-face. If the visit is conducted remotely, the research staff will complete the informed consent form with the participant, initialing all the boxes and signing and dating the form. The form will also be signed and dated by a witness. A copy of the informed consent form will be given or posted to the participant depending if it is face-to-face or remote visit. A copy will be sent to BCTU and a copy will be kept in the participant's medical notes. The original informed consent form must be kept in the investigator site file. This is an example of the informed consent form. Randomisation will be provided by a secure online randomisation system at BCTU. Unique usernames and passwords will be provided. It is available 24 hours a day, 7 days a week. The Calibre Trials team are available Monday to Friday, 9 till 5, except for bank holidays and University of Birmingham closed days. Once participant eligibility has been confirmed and informed consent has been taken, the participant can be randomised. A randomisation form must be completed and forwarded to BCTU. If data fields are missing, the randomisation will be suspended but can be restarted once the information is available. This slide shows the home screen of the Calibre randomisation database. A test database is available to practice on at trialtest.bham.ac.uk/Calibre. If you have any issues whilst randomising, please contact the Calibre Trials office. The two treatment arms are carvedilol and variceal band ligation. For participants randomised to the carvedilol arm, they will be prescribed 12.5 mg of carvedilol to be taken once a day for the 12 months that they are in the trial. They will have a follow-up visit at 2 weeks to assess for any adverse events. This visit can be carried out either face-to-face or remotely. If at a remote visit, the clinician feels the participant needs to be seen in clinic, the CRF should be completed at the face-to-face visit only. For participants randomised to the varicose banding arm, they will be banded at regular intervals, usually 2 to 4 weekly, until the varices are eradicated. After successful eradication of varices, further endoscopies will be carried out as per local standard practice. Any recurrent medium to large varices are treated with further varicose band ligation until eradication. Treatment can be modified at patient preference or at clinician's discretion. If varicose band ligation is not tolerated by the participant, carvedilol can be offered at 12.5 mg once per day. If 12.5 mg once a day is not tolerated by the participant, the dose can be split to 6.25 mg twice a day. If that is not tolerated, the dose can be reduced to 6.25 mg once a day. And if that is not tolerated, another beta blocker can be prescribed as per BSG guidelines. This slide shows the schedule of assessments and when they take place. We are only asking for standard of care blood tests and no additional blood tests will be required. Please note the 2-week safety visit has a plus or minus 1 week window, and the 6 and 12-month follow-up visit has a plus or minus 2-month window. The primary outcome of the trial is any varicose bleed within 1 year of randomisation. Secondary outcomes include the time to the first varicose bleed, mortality at 1 year from randomisation caused by all-cause mortality, liver-related mortality and cardiovascular mortality, and transplant-free survival at 1 year from randomisation. Secondary outcomes also include any adverse event related to the treatment up to 12 months from randomisation, other complications of cirrhosis, patient preference, health-related quality of life at trial entry 6 months and 12 months, the use of alternative therapies and crossover therapies. There are a number of different patient withdrawals, from total withdrawal to withdrawal from trial treatment but continuing with data collection at standard of care visits. An additional withdrawal option has been added, which is the withdrawal at the request of the Calibre Trials Office due to significant non-compliance with the protocol. Data handling. The source data used in the trial will be the patient-reported data on the EQ5D5L questionnaire, standard of care laboratory results, clinical event data, health economics data, recruitment, and any withdrawals. The case report forms will be paper records completed by sites. CRFs are considered complete when all data fields have been completed. Please ensure that there are no missing fields, as this will lead to data queries. And please also do not write free text on the CRFs outside of the free text fields. The original or a copy of the CRF should be sent to BCTU, keeping a copy for the investigator site file. This slide shows the latest version control document for CRFs. Up-to-date CRFs and version control document can be found on our website. This is an example of the baseline form. Missing or ambiguous data will always be queried. Staff at BCTU will transcribe the data from the paper CRFs onto a database. Site staff will not be able to amend the CRF online but will have read-only access. This is a summary of the security measures we require in place at sites to protect the data. This includes physical security measures and access control. Pharmacovigilance. The definition of an adverse event is any untoward medical occurrence in a patient or clinical trial subject administered to a medicinal product which does not necessarily have a causal relationship with this treatment. The definition of an adverse reaction is any untoward and unintended response in a subject to an investigational medicinal product which is related to any dose administered to that subject. The definition of an unexpected adverse reaction is the nature and severity of which is not consistent with the information in question set out in the SMPC or the investigator brochure for that product. Definition of serious is any adverse event, adverse reaction or unexpected adverse reaction that results in death, is life-threatening, requires hospitalisation or prolongation of existing hospitalisation, results in persistent or significant disability or incapacity, or consists of a congenital abnormality or birth defect. Whilst these events fulfil the criteria of an SAE, they are recognised complications of liver cirrhosis and do not need expedited reporting. Instead, they will be captured on the CRFs. If you are in any doubt as to whether the event is to be reported on an SAE form or not, please contact the Calibre Trials Office for advice. Any SAE not listed as expected in the protocol must be reported to BCTU on an SAE form within 24 hours of site becoming aware of it. BCTU will report SAEs to the DMEC, MHRA and REC as appropriate. So if the event is serious but expected, as detailed on page 46 of the protocol, the event is reported on the follow-up CRFs. If the event is serious and not listed as expected in the protocol, it must be reported on an SAE form and faxed or emailed to BCTU within 24 hours. This is an example of an SAE form. Just to recap, all expedited SAEs and SUSARs must be reported to BCTU within 24 hours of the site being made aware of the event. PI responsibilities include reading the approved protocol and sign and return the PI page on page 9, adhere to the approved protocol, be responsible for enrolling only those patients who meet the eligibility criteria, and Calibre is also registered with the Associate PI scheme. The investigator site file should always be kept up to date and could be monitored by study staff or a representative of the sponsor. Please keep consent forms, copies of paper CRFs, SAE forms and any file notes in your investigator site file. These are the Calibre trial team contact details, and please do not hesitate to contact us if you have any questions or queries.